Today I have the fortune of having the ADHD Whisperer, Ms. Selina Lee, and we're going to be talking about the 25 ADHD myths that she created in an infographic, and we're going to debunk these myths because one of the things that we try and do during October is bring awareness to ADHD, and there are a lot of common misconceptions out there for individuals with ADHD, and it gives a bias to how people see you if they find out that you have ADHD. So, hello, Selina, thank you for joining us.
Thank you for inviting me.
So do you want to just give us a little bit about who you are and how the ADHD Whisperer group started?
Yeah, so I was seen as neurotypical up until I had a child, and that child was a little boy who was always in fights and always impulsive and always in trouble, and I just couldn't understand. Even from when he was born, he was like really unable to regulate himself as much as you would think. And I had trouble parenting, even though I read parenting books and took lots of advice. And so it was very hard to bring him from baby to school. When he got to school, it was even worse. And he got suspended, and he was always in trouble and fighting. So I couldn't work it out. I read everything. And in the end, I took him to the doctors, and they said ADHD. And I thought, no. I give my children vegetables. I give them strict bedtime routines. And then it was finding out all the facts about ADHD and reading about ADHD and thinking I was a bit ignorant beforehand because I just assumed they were naughty or lazy or too much sugar or not great parenting. So that's how I came to learn about it. And I thought, well, if I'm like that, there's many people out there like that, and I want a better world for my children. So I keep learning and keep trying to educate people and make it a nicer world for my children, because we all have it now. I've been diagnosed after my children. I'm just on the high functioning coping side.
Thank you so much for doing it. You have a lot of great resources. Again, that is the ADHD Whisperer group on Facebook. And if you haven't checked it out, I definitely recommend it. You also have a Facebook page under the same name, don't you? Is that correct?
And that's open to the public, so that they can see it and learn. I put lots of things up there, but it's not the support group. The support group is closed and private so that we can help each other and understand each other without the judgment. I try and make it a safe place without judgment. But I also at the same time try and post some things up, some articles up for the public.
Great. So before we start going into these 25 myths, if you take a moment to like the Garforth Education Facebook page and the ADHD Whisperer Facebook page, it means that you'll start seeing some of these events that we're doing pop up on your feed. And Selina and I have talked about doing some more events in the future because, it's great information, and it's really important to help better educate the population and ourselves about what exactly ADHD is, what it isn't, how we can spot it in different individuals, and how we can help support those who do have it. So let's begin with our myths. Now, the first myth is that ADHD is not a real medical condition. And actually it is. It is a real medical condition. It's been shown on PET scans or brain scans, and it is that the brain is functioning differently than someone else. And of course, there's a huge range of brain functioning and what's considered typical and atypical, or neurodiverse. And this is just one of those conditions that does cause neurodiversity.
Yes, I find it much easier to explain. This is why I like to explain the ADHD, and that's obviously the number one myth. It's a behavior. You choose your behavior. If you have a broken wrist, everyone can see the broken wrist, but they can't see the thoughts in your head. They can't see the brain chemical levels in your head. So saying that it's a physical problem with producing, carrying, transporting those brain chemicals is easier for them to understand that it's beyond your control. It's easier to say that it's physical, because otherwise they think, well, the brain, there's your thought, there's your willpower. So why can't you just choose those behaviors?
Yeah, of course. And it's important to know that they probably would if they could, right? It's not intentional. And, they get just as an individual with ADHD that has those impulsive behaviors or the inattentive behaviors, the hyperactive behaviors, it's not that they're doing this intentionally or on purpose. And there are a lot of the times where if they didn't have to, they would have chosen not to, if it was an option.
Oh, yeah. I find it quite sad, actually, because you see they have these fights with their brain. They struggle on fighting their own impulses and what they can and can't do, and trying really hard to focus when they can't. And everyone's saying, focus, focus, focus. And then when they lose that fight, which is a lot of the time, they get really sad and they get really upset about the potential fallout, and they get remorse and they don't like themselves, and it affects their self-esteem.
Yeah. So it's a huge thing that you really need to take the time and realize that they don't want to be doing this. And, there are some aspects of it that is just who they are. And maybe they're just a person that needs to be really active and live that active lifestyle, and that's fine. But there are other parts that they need support in controlling or having, the ability to pay attention or wait. So let's go on to myth number 2. ADHD medications lead to addiction. And this, again, is not true. Studies show protective factors for medicating someone with ADHD. And the thing is, when someone with ADHD is medicated, it's helping replace a hormone or a chemical that they are naturally low on. So they're not able to have that naturally occurring in their body. So they need that help from the medication. And several individuals who are not medicated will look other methods for helping get that same effect. So they may turn to recreational drugs such as marijuana or alcohol, so they can get that quietness that they're not able to get otherwise.
Yeah, this is a very misunderstood thing. We're trying to make ourselves up to a normal level. We're trying to fix a deficiency. And it is very common with like alcohol and illicit drugs, but it's also spending, getting the buzz from shopping, and the impulse to buy. It's food, because we get those chemicals from our food, especially the carbs, the sugars. So it's addiction in all areas, gambling even. So people don't understand, we're just trying to look to fix something inside, and our brain isn't giving us a choice. It doesn't say, well, body, what do you think of this? We'll go through this. It's just demanding something, and you're trying to find and fill that where it needs fixing.
Yeah, and then you see the risk-taking behaviors to get that adrenaline rush, especially in the teenagers. And the people in their 20s that do those, extreme sports and vacations and the cliff jumping and extreme backhill country skiing. And there's nothing wrong with it, but this is why they're doing it, to get that adrenaline rush in their brain, to boost those chemicals that they're lacking. Myth number 3 is that ADHD is a boy-only disorder. And that is definitely not true. Girls do have ADHD. They can have it as severe as boys or males, and it's very underdiagnosed in women. And one of the reasons this is because the way that they express their ADHD characteristics or symptoms are different than the males. And it's just a matter of figuring out what those clues are.
Yeah, so I think it stems also from, they used to think it was just a boy disorder, didn't they? And so all of the assessment was done based on little boys, and then all of the diagnostic tools that they created later were based on little boys, and then how to medicate or treat was based on little boys. And little boys and little girls are very different. And generally speaking, there's, presentations that are different with the boys and girls. And they even call it a girl presentation and a boy presentation, because in the beginning, they used to think it was just the hyperactive, impulsive, and then there was separate names for separate disorders. And now it's all come under the ADHD umbrella of inattentive for a girl presentation, even though lots of boys can be inattentive. And it's hyperactive, impulsive for the boy presentation. And then there's the combination of two, but it's not, if you're a girl, you have one, and if you're a boy, you have another. It's just the way girls and boys generally present.
Yeah, and also there's the added fact that females are often more socially conscious and trying to fit in and able to mask or hide these behaviors and try and make them not as noticeable. But there definitely are, the little children that are running around, bouncing off the walls, needing that physical input, regardless of whether they're female or male.
Yes.
It's just learning what to spot and how to catch those children that aren't showing that hyperactive impulsive presentation. Those inattentive children are not the squeaky wheels that you're seeing. So they're easier to let fall through the cracks when it comes to diagnosis and saying, simply that they're not interested or, they haven't had enough sleep, when really if it's something that's consistent and persistent across areas. So it's not just when they're at school, it's when they're at home. It's not just when there's something boring happening, it's when there's something exciting happening that they should really care about and want to be involved in, right? It's realizing all these different components that factor into that ADHD diagnosis.
Yes, I find it especially hard when they're not the squeaky wheel. A lot of the experts these days are focusing more on the missed diagnosis of females. And like me, for example, diagnosed at age 40 after my 6-year-old son. And I feel it a lot. And especially now that I recognize when and what is happening, that I have done quite a lot in my life leading up to it. I don't have as much resentment or regret for what could have been. However, I see many women say, why didn't they help me when I was younger? Why did they let me struggle? And it's not blaming anyone in particular, but it's a grief, it's a feeling of loss, a feeling of what could have been, the potential. So I like the fact that these experts are saying, let's look at boys and girls, and let's not say that one girl for every 4 boys diagnosed. Let's just see that they present differently, and possibly they're off daydreaming and their thoughts are colliding in their head. They're better at mimicking and masking for social events.
Well, and then something that you brought up there is that you got diagnosed once your son did. And there are several parents that fall into that category where, you know, ADHD is just becoming more of that common term in the past couple of decades. And it was this increased awareness and this knowledge that's coming out is meaning that parents are becoming more conscious of these symptoms. Like, well, yeah, you know, I was like that when I was a kid. I don't have ADHD. And they're like, oh, maybe I do.
Yeah.
Right. And then you have that snowball of diagnoses that can happen in a family once one individual is identified. And then siblings, parents, cousins, aunts, uncles, like, oh, maybe it's me too, right?
Yeah, so when my son was diagnosed, the pediatrician looked at my partner and I and said, so your son has ADHD. And then she did a big pause and she said, and it's genetic. So we had to do our own investigation and we were like a bit shocked, and I blamed him and he's like, of course it's my fault.
Yeah. All right. Myth number 4, ADHD is the result of a poor diet. And this is, again, something diets can help, but it will not cure ADHD, and it doesn't cause ADHD either, right? There are things that you can eat that aren't going to help anyone with their concentration or their energy level or their ability to focus, but it's not what's causing the internal problem. It just exacerbates it.
Yes, I feel that when you do get a diagnosis and it's new to you as a parent, because of the myth and stigma that we're trying to stamp out, that they do say, okay, well, we can fix it with diet, we can fix it with vitamins and minerals, and we can fix it with no sugar, and you will help. It will help. If you're on a good diet, it helps everyone. But yeah, it definitely hasn't caused the problem, and it definitely won't cure the problem. But anyone eating healthy will feel better, but it is a deficiency in the brain chemicals in order to focus and use working memory and executive functioning and all the other aspects of those brain chemicals that we need with our higher functioning and not just breathing.
Definitely. Myth number 5 is ADHD is due to bad parenting. And this is a huge misnomer, and especially parents that have children with ADHD often get this unwanted advice where parents assume that they haven't tried some of the common things that are just magically going to take ADHD away. So, you know, traditional forms of discipline like timeouts are not going to cure ADHD, and having them is not going to create the ADHD. The ADHD is intrinsic to the person. It's neurobiological in nature, so it's brain-based. And while there are things that you can do as a parent to make it better, there are things that you can do to make it worse, but it's not going to cause it.
No, I totally agree here. You said that all the free advice in the world you get when you have a baby, everyone comes at you with this advice: do this, do that, oh, I did this, I did that, and you can be really overwhelmed, especially if ADHD is in your genetics. And I in one way was very unfortunate that I got the child that was so disruptive first, because my younger one has ADHD and autism and anxiety as well, but they're like chalk and cheese sometimes. So I could put him to sleep and he would just go to sleep. My first one wouldn't. He was like evil. And so I tried everything, read all the books. When we got the diagnosis, I actually felt better. I was like, oh, it's not me. And I find a lot of parents feel that way. I think it's a relief that they've found some sort of reason other than you're a bad parent.
Well, and that's the thing, like it's a diagnosis, and it gives you that ability to identify the behavior to the ADHD. So when my child does this, it's because of the ADHD, right? They can compartmentalize that behavior, explain that behavior, and that leads to a better understanding within the relationship. And it does help the child and, or the adult, or whatever age they may be, realize that it's not because of who they are as a person, because of how they've been raised or what they believe. It's who they are because of their brain chemistry, their brain physiology. It's who they are.
On this point, it says their traditional discipline does not cure nor create ADHD. With the parenting, we do have certain expectations of parents. We have what you should do and what you shouldn't do, and it all falls within the neurotypical realm of what you should and shouldn't do. So sometimes you do feel that you're trying to keep it that way in the neurotypical realm. You're not actually dealing with your reality. You're dealing with what you wanted it to be, what you think it should have been, what it could be if you tried hard enough. But sometimes it actually does take a shift in thinking from the parent to make some calm at home, because, they say, don't ask a one-legged person to run a two-legged race. Sometimes parents' expectations of their ADHD child aren't realistic.
And that's exactly, especially where the conversation of executive functioning comes in, right? So executive functioning are brain-based procedures and the ability for your brain to act as the CEO and help you prioritize and do these things. Now, individuals with ADHD and other neurodiversities have a lag in the development of executive functions. Executive functions are natural processes that your body is pre-wired to develop in the right circumstances, and they don't start developing until around age 5 in a neurotypical individual. Now, someone who is neurodiverse, there is a delay in this development between 3 and 5 years, sometimes longer. And these are executive functions develop into your 20s, regardless of whether you're neurodiverse or neurotypical. So they have a long time to develop. And I think it can be really difficult for a parent that has has a child with a neurodiversity, because your child's this old, they should be able to do this by now. But if they don't have the prerequisite executive functions, and those have a delay in development, things like picking out your child's clothes in the morning, that's something that you may still have to do because they don't have the ability to do that yet. And you're not able to relinquish control on that. Same comes with, the personal care responsibilities and chores.
Definitely. I find this a very challenging one. And I think it does take a long time to get your head around it. And when you do, things do become more calm at home, and there is more of a good rapport between you and your children. It is a hard one to drop the expectations, but I feel it's good to learn and educate yourself on these particular things. Like you said, it's the executive functioning, the extra detail, the extra thought, the higher hindsight and foresight and prioritization that really does take longer to develop.
Right. Myth number 6, people with ADHD are lazy. And that's not true. they actually lack dopamine, which is the chemical that helps create the motivation and gives you that ability to just take that first step in doing things. And so they have a decreased amount of this, and it makes it harder for them to do that task initiation and start it. There are also issues about knowing where to start and over planning that come into place as well.
Yeah, this whole dopamine, they did used to think it was the reward chemical, and they still do, but it's more the, like you said, activation. It's the task initiation. It's the trying to find the energy to do something, the motivation behind getting that reward. So lazy might be paralysis and overwhelm. It might not be, I mean, I don't like the term and we've got to stop using it, but it's, are they overwhelmed with the whole task? Have they taken in the whole picture, and are they not able to break it down into little tasks in order to get started? Do they think they have to do it all? And there is also a lot of, because they see the whole task, there is an aspect of ADHD where they don't want to fail, they don't want criticism, they get exposed to more criticism because of their symptoms. So they fear failure, or they fear not being good enough, or so that can really be at play as well. When you think, are they lazy? It might just be, it's such a struggle.
Well, and then the other thing to talk about is when ADHDers often have some tasks that they're able to hyper focus on, right? That they're in the zone and they become time blind, and they're able to just get so much done, and they're just very, very productive. And then an outsider will say, oh, well, if this were insert zone topic here, right, that area that they can hyper focus, you'd have no problem doing it. And yeah, that's true, but that doesn't mean that they can take those skills that they can use in that zone and apply them to another area.
Yeah, exactly. That hyper focus is a real benefit sometimes, but it can also be a deficit. You know, you forget to eat, you forget to listen to your body, so you run off because you're busting for the toilet. You are just hyper focused on that one thing. My children, when they're hyper focused, you can be yelling all you like. You have to actually touch them to make sure that they are in the same room with you, listening to you. So yeah, it really does have a part to play. And again, it's the understanding, isn't it? Because saying, well, they won't do this, but they'll do that. That's so they must be lazy is really not a good thing. And it's the understanding of how the brain works. Very interest-based is ADHD.
Well, and one thing to bring up is even something so much as cleaning up a room can be so overwhelming, because depending on the ADHD area, there may be absolutely everything everywhere, because that organizational system is difficult for them to develop sometimes. And even knowing what the first thing to pick up is overwhelming.
Definitely, definitely. I totally agree. I find that some expectations on women about tidy house, tidy mind, our housework, and there are a lot of expectations on, we must be good at our jobs, we must be good at the home, we must be good with the kids, we must do a lot, and it can be overwhelming. And just doing the tasks, the little tasks, we don't see them as little. We can be paralyzed with what we need to do.
Definitely. People with ADHD are stupid. And this is definitely something that needs to be debunked, because intelligence does not correlate with ADHD. That means that individuals that have ADHD can have an extremely high IQ, and they can also have a very low IQ. So it's something that we see in comorbid or co-occurring with other conditions that affect intelligence, whether it's giftedness or someone with a cognitive impairment.
Yeah, so this they say a standardized test, like a WISC or a Wechsler, an IQ test, or their cognitive abilities, a standardized test for non-standardized brains doesn't work quite well. And so what you have is much peaks and troughs. They might be brilliant at one thing. An example I can give is my older child is great with grammar, spelling, punctuation, and then it looks like dysgraphia. We haven't got a diagnosis yet, but the dive on the writing, even though the spelling and punctuation and grammar and understanding is there, because it's the multiple tasks at once. It's doing multiple things at once. So you can look like you're not able to do certain things, but then you can look like you're a master at other things. And so I would really love that one debunked forever, and know that it's, again, understanding that we are different in the way we learn, the way we think, the way we react to things. Definitely no correlation with intelligence.
And it's important for educators and employers to realize this, because you need to figure out the best way for the individual to do the task at hand. And that's especially true when it comes to, you know, their formal schooling. So the activity or the assignment that you're trying to get them to do may actually test their ADHD so much that it means that they can't actually show you their knowledge. So that's where the accommodations and the adaptations come in, so that they're able to show the knowledge that they have and not be trying to present it to them or to you in a way that's going to tax their ADHD.
Yeah, see, that thing with writing, we know a really good teacher, and she was able to identify that speaking to my child, he could give the information, but writing it down was not possible. So she scribed for him. And that's the first time I thought, oh, wow, somebody's actually going to effort and scribing to help him. It's not like she was giving him the answers. She was taking what he said and writing it down. That was so helpful, so good. And there's so many things you can do. And in this, there's also the audio processing versus visual processing. Some people learn by listening, and others by doing, and others by seeing and watching. So it can be very hard. I feel for the educators. I do think it is a hard, tough job, and they all deserve pay rises, but it's something where they have to go across many different ways of learning.
Yes, definitely. All right, the next one, ADHD is not that serious. And this is another one that we need to debunk, because people with ADHD take risks, and this can cause them to be at heightened risk due to their impulsive or their risky behavior.
Yeah, so I do have people in my group that have lost family members due to risky behavior, and it's tragic, and I have all the empathy in the world for them. It makes me quite emotional. And this is another reason I fight so hard, because we shouldn't have to lose these people. We shouldn't have to have them have all of the, it could be accidents like on the road, scootering and bicycling. And then it's also later on, like you say, the teenage risky behavior, the drinking, the possibly taking drugs without any knowledge of what they're taking. But it's also driving. They say many car accidents, and so being medicated helps that, or being treated and understanding when you're better in the morning or in the afternoon, when you're more alert, when you can cope better. So again, education. But there are so many that have been lost to risky behavior, impulsiveness, and not thinking things through, and trying to get that chemical level.
Right, exactly. So ADHD is something that we need to take seriously, and we need to find ways that we can help support the individual so they can succeed as much as possible on their own. And, you know, it is a public health issue that we need to make a more serious focus of our attention. ADHD only impacts you at school. And this is a huge myth that we need to get rid of, because ADHD doesn't go from 9 until 3. It goes 24/7, and you don't get a break. It's something that's always with you your entire life. Yes, there are strategies that you can have to support it and make it so some of the ADHD characteristics or symptoms aren't as severe as they may be in other conditions, but it doesn't go away. So, you know, things like even trying to fall asleep can be a huge problem for individuals with ADHD, because they're not able to turn their brain off and just get into that relaxed state in order to fall asleep.
Yes, with this, you mentioned sleep. ADHD is, many have big issues with sleep. And again, understanding the brain chemicals that we're trying to achieve. The serotonin, for example, that helps to produce your melatonin, which is the sleep hormone that gets you ready for sleep. So if you don't have enough serotonin, you're not going to have enough melatonin. It's just the way it goes. So there are some experts out there that actually want to classify ADHD under sleep disorder, like narcolepsy. Narcolepsy use the same medication as ADHD. They use stimulants to try and stay awake and not fall asleep while they're driving. So there's heaps of interconnectedness and complexity with your brain chemicals on how they display and motivate you or not motivate you, or keep you awake at night and don't switch your brain off. You need that calm. You need to understand what is working where and when and why. And that's also what I try and help people with, because it took a long time for me to understand and reading. So I think, well, maybe they don't have to spend the years reading everything, and maybe we can pass on some of the information we know, that, you know, it's not just one small child at school struggling to concentrate or focus. It's all of our lives. It's all of everything. It's the older generation. It's work. It's driving. It's everything. And it's really important. Although that schooling, you'd want to get that down, and foundational schooling is a really big part of life. So that's why we want to get early intervention in.
Well, yes. And the other thing is, some people may see their symptoms lessen as they move away from school, but you also have to realize that once you're out of that formal schooling, you know, from kindergarten to year 12, you also have the opportunity to be more selective in the settings that you place yourself in. So if you're able to find a career that supports your niche, or that area that you're able to hyper focus in, then your symptoms won't be as apparent, and you're able to be more selective in keeping yourself away from those situations that really aren't the best for you based on your strength and weakness profile.
I will say though, with that, it only impacts you at school. It does get some crossover myth or misunderstanding about, well, we take medication breaks on the weekend. People do that and are advised to do that by their doctor because it's an appetite suppressant. If we're talking medication, then they're trying to get their child to eat more. So there are valid reasons why someone might take, you know, breaks from treatment medication or other things. There are valid reasons, but you still have to understand why and where, and try and obviously counteract some of that deficit and know that it's not just for school.
No. So ADHD kids need to try harder to focus. And again, ADHD is a chemical deficiency in the brain. So no matter how much they're trying, if they aren't able to do it, it's not something that you can just tell them to do and it'll be able to happen, right? It's, you need to focus now. That's not going to help the situation.
No, and sadly, it's one of the easiest things that parents say. I even still say it, and I know I shouldn't, and I'm not perfect as a parent, and many of us aren't, and we do get frustrated, and we do say and demand, please try harder. And it's one of the easiest ones to slip back into because of the expectations and what you're used to and the traditional way of doing things. So I do understand where that one comes from and why, and I have empathy and understanding, but learning about it more and just saying, try harder, focus harder, concentrate isn't going to make it happen.
Well, and even if you think about it for yourself, you know, if you're having that time where you're struggling with focusing, you can tell yourself time and time again, okay, now it's time to focus. But if you're not in that mindset, it's not going to happen. And hearing about it's only going to make it that much harder.
It is. And, you know, sometimes we can't pick what we're going to focus on either. That's a problem. Because sometimes I like to focus on, you know, history of how things are made on the internet, and we go down rabbit holes. And when I really should be doing that report for work. Yeah, so sometimes it's really hard to redirect. That's a part of it, isn't it? It's redirecting focus. That's also a thing that we can't do.
In the same voice, myth, the next myth is ADHD kids cannot ever focus. And they can focus if they're interested, but have no choice in it. So that means that there are things that they can definitely hyper focus on, whether they want to or not. And it may be a situation that they're trying not to, but they can't not do it.
Yes, and especially kids. I mean, kids love their downtime, their leisure time, their playtime. So they're more interested in that Minecraft game rather than learning algebra. Who isn't? So yeah, it is the interest-based, what we can and can't focus on. And I think that ties in with your emotions as well. ADHD, I describe as a self-regulation issue. You cannot self-regulate. All the filters in there, you've got more intense emotions, you've got an inability to redirect your focus. So if you're loving a particular game that you're passionate about, or a particular interest that you're focused on, then you are not going to be able to tear yourself away to do the boring stuff. And when it's boring, it's really boring for ADHDers.
Yeah. And it's figuring out that, you know, that sweet spot, right?
Yes.
All kids with ADHD are hyperactive, and some kids are are ADD without the H for hyper. And this has to do with the change in terminology. We get our diagnostic criteria from the DSM, which is the Diagnostic and Statistical Manual. It's currently in its 5th edition, and each edition creates changes to definitions and terms based on what the research is telling us. And so it's trying to make it so that things are as consistent as possible and can be used globally. And so there used to be attention deficit disorder and attention deficit hyperactive disorder. they have combined those into one term now, and there are 3 presentations. There is a hyperactive impulsive presentation, the inattentive presentation, and the combined presentation. So depending on the presentation will depend on whether that hyperactivity is a component of the diagnosis. So a child or an individual that has ADHD inattentive or primarily inattentive presentation means that they don't have that hyperactivity as part of their condition. So it is just that they're having that struggle to maintain the focus, and they don't have that same need for that movement.
Yes, and it's also how that presents, because you can actually be hyperactive with your thoughts internally and not show it externally. Or you've managed to, young children, everything's external, and then they slowly bring it in internally with their development stages. All their thoughts are straight out their mouth when they're young, and then they realize that not all the thoughts that they think has to be coming out of their mouth. So I find sometimes I can be, my mind is just all over the place with my thoughts, and it's actually hyperactive thoughts. It's distractions and thoughts coming through all the time, knocking each other out. And I could just sit there and not look hyperactive and not display it externally, but still feel it internally. And I think the coping mechanisms for many people do that as they get older. So they can change from what would appear hyperactive and be diagnosed the hyperactive. And then later, because of coping mechanisms and not wanting to appear out of the norm, they have internalized a lot, and they're still hyperactive, but you can't see it because of their coping mechanisms.
Right. The next one is all kids, oh no, sorry, we just did that one. ADHD girls never experience hyperactivity, and that's wrong. Girls can, and they do. They just may show those hyperactive characteristics differently.
Yeah. So again, it's the internal, external, how you display things, how it's read. I think there's a lot of expectation on the females to comply more. So the squeaky wheel might be the boy jumping around, but the girl is as hyperactive, but she might just be showing it in different ways. Or you can get that one that's jumping all over the place. Yeah, just because it's a girl presentation and a boy presentation doesn't mean it can't vice versa change around.
Definitely. Kids grow out of ADHD and adults can't have it. And again, this is wrong. More than 60% of adults keep their ADHD symptoms into adulthood. And it's, again, the matter of seeing the change of situation and the change of dynamics. So maybe the adult has chosen a career path or a life choice that fits their needs and their strengths better. So they're not focusing on the areas that they're weak in. They're not having that same forced sit down situation where they're learning a variety of different topics that don't necessarily fit their interests. And they have more ability to control how things are done and schedule life so it works better for their needs.
Yes, definitely. This I feel that those statistics might grow actually, because again, it's covering the coping mechanisms, and also the knowledge base has increased, so we're able to identify those children younger, early intervention now. And so there are lots of people like me who have been diagnosed after their children, and heaps of us. In fact, I did a poll the other day in the group, and more adults than children were diagnosed. So that there was this huge chunk, obviously one child gets diagnosed, maybe two parents get diagnosed. So there's a huge chunk of adults being diagnosed at the moment.
Definitely. And the other thing is, again, because it wasn't as a prominent area of discussion earlier, again, the not diagnosed and then diagnosing later when you have a child, but also as an adult who's, maybe a friend saying, hey, have you thought of this? And the other thing is those who have turned to self-medicating as a teen with, drug use, alcohol use, or those who are very, very athletic in high school and have the ability to self-regulate through their sports and exercise. And when that's taken away and just the new format of life changes, they're not able to have the same results.
Yeah, lots of structure when you're young, lots of your parents doing things for you, even if it's not you at the right developmental stages, your parents will chime in and help you and let's get organized and let's do this and this is what we're doing. So there's lots of fallback and lots of help. And sometimes when you don't have that anymore, there are ones that come off the rails and there are ones that self-medicate and they realize that actually there's something more going on there.
Definitely. ADHD is a learning disability, and this is not true. ADHD has to do with internal self-regulation issues and those executive functioning skills. ADHD can co-occur and often does co-occur with a learning disability, but the ADHD characteristics and components do not cause the learning disability.
Yes. Again, I think this relates back to you're stupid if you have ADHD. They don't understand it is a self-regulation issue. It's the chemicals not allowing you to refocus or to pay attention or to initiate a task or finish a task. We're good sometimes at initiating lots of tasks and not good at finishing any of them. So we have many ideas, lovely, great, passionate ideas and fun, but yeah, actually finishing them, not always great. So I feel that sometimes that does lend to the negative side of lazy and stupid and you can't learn. It's maybe got to be a bit more interesting, a bit more support, a bit more structure and scaffolding for the person. But yeah, they do have many comorbid conditions.
That goes into ADHD is a solo standalone diagnosis. And ADHD nearly always comes with another diagnosis, whether that comes with mental health issues, learning disabilities, autism, sleep issues, control issues, RSD, response sensitivity, sorry.
Rejection sensitivity.
Dysphoria. Sorry, and so I use the acronyms so frequently, I often forget what they stand for. Oppositional defiance disorder. And there are things that we can do to help try and protect about some of these, but you have to realize that these are common co-occurring conditions when it comes to attention deficit hyperactive disorder.
And again, it's understanding the why. Why are they? Why do they all come together? Well, if you can't use that executive functioning, that CEO part of the brain, because you're maybe developmentally behind and it's actually physically a smaller part of the brain on brain scans, then you will not be able to do the extra things you need to maybe understand those maths problems. And so dyscalculia can jumble that. You can be lost in the thought processes. And dyscalculia is maths and dyslexia is words and letters, isn't it? So, I'm not great with all of these, but you can understand if your brain is not ordered and it doesn't have the correct working traffic lights in the brain for your thoughts and your processes, that it can lend itself to other conditions coming in. Again, with the emotional dysregulation, anxiety and depression, that's the serotonin is the mood regulator. Mood, food, and sleep is what it is. So if you don't have something regulating your moods, you can be really intense or really, really apathetic and numb and disconnected. And so that can go either way. The high anxiety or the depression, won't feel anything, can't get out of bed. So the reason you can't do all of these things is the chemicals themselves. Understanding those things and why they are and what they represent, I feel, is a big key to helping yourself.
Definitely. Medication is the only way to treat ADHD. It's important that we realize that ADHD is a spectrum and requires many treatments to help create the most opportunities for success with the individual. The medication is only going to help with helping level off the chemical imbalances within the brain. And there are still supports that are going to need to help regulate the behavior, control those hyperactive and impulsive moments, and skills for the individual to learn to help with the inattentive tendencies in different situations.
Again, the biggest thing I feel is education. The biggest thing is the understanding. So, I mean, I am a real advocate for trying to help yourself early and easy. And with these tested medications, they're great. I mean, a stimulant medication has been around since 1937. That's over 80 years. And they've tested it and retested it and reformulated it, and they have many different delivery mechanisms for the different individuals, because we all have different neurotransmitter levels and metabolisms and comorbidities. So I love the fact that we've got that there, and the science base and the evidence base for the medication. But they're like glasses. You take it off and you've still got bad eyesight. You've still got the need for glasses.
One, the other thing with the medication is just because you find one, or you try one, doesn't mean that's going to be the right fit. So you have to be willing, when you decide to go that medication route, to do a little bit of trial and error to find the right combination of medications and external supports to help you succeed. And the first one that you try may not be right. But once you find the right medication, it'll be that you notice when you don't take it, and it really affects you. Like, you know what, I'm so much better when I take it. I really want to do that.
Yes, and like you said, the trial and error, there are so many indicators there as well that you can educate yourself on. In the 1980s, they used to have this, going to change their personality, make them a zombie. I don't want my child losing their spark or being a zombie. So that sometimes is like a higher dose than they should have. So it really dulls them down, their personality. So there's lots of education that you need to do. And as soon as that medication is gone, or even when it's in your system, it's not going to make you do everything perfectly like you're a robot going around and fixing everything. It's just going to help bring your levels up to normal in the brain, up to where a neurotypical person would be. And so you have a better chance at doing those things. It's not going to automatically clean your house. You need understanding about the condition. You need understanding about your strengths and your weaknesses, and how to use your strengths to overcome your weaknesses and proceed for you in a way that's going to help you get what you want out of life. And whether that's to be calmer and happier, that's great. And whether it's to be productive and do more because you feel like you're not achieving anything, that can also be done. But it's the education, and with that is the therapy, the taking your children to a psychologist that understands ADHD so that they can give you a mental toolbox of what might help when, especially when they're younger and they've got those intense emotions. You could have the counting and breathing exercises and all of those extra things that you can implement if you've practiced them a lot, if you've done understanding of the regulations of your emotions and what to do. I think therapy really does help, and they do say that medication and therapy are a combination thing. It's not one or the other.
Exactly. Medication is a quick and lazy way to treat it. And this is not true. It takes a while to find the right medication combination for the individual. It's not like a fix-all for everyone. They do need support. It is, however, a recommended treatment. So it is an avenue that you should explore if you're comfortable with it, to help support the individual regulate and live a productive life with their ADHD.
Well, this is a thing in group at the moment. The doctor prescribes a stimulant medication. It takes lots of guts for a parent to give that to their child. They're risking everything to give it, and then it doesn't work how they expect it, and it's not the fix-all perfect. When you're dealing with ADHD, you're also dealing with other issues. You're dealing with not just the focus, you're dealing with the emotion and dysregulation of everything, really. So if you've got comorbid conditions, that's when they show up, when you quieten down that ADHD. And you need to understand that if you have a few conditions, one thing might not treat those few conditions. You keep saying medication combination, and they keep recommending that. All the experts, it's a combination of things. It's not just one thing. You need to really have understanding where you're coming from and how to get where you want to be, with the education about how you are, your metabolism, your comorbid conditions, and a combination of treatment across the board.
Right. ADHD special accommodations are an unfair advantage. And this is as big of a rumor for ADHD as it is with other exceptionalities such as learning disabilities, autism, any disability really. It's not an unfair way. It levels the playing field for individuals that have ADHD so that they have a better opportunity at succeeding with the same activity as their peers. It means that you're not testing the ADHD in them on top of what you're asking them to do. It would be like saying to an individual who wears glasses, you can't wear your glasses because it's unfair to everybody in the classroom. And the only way that you can wear your glasses is everybody else in the classroom wears the same pair of glasses with you. And very quickly would be like, hey, that's not fair. I need a different prescription. Or no, it's going to make me see it blurry. So it's not an unfair advantage. It's trying to make it so that you're not testing the individual's weaknesses.
Yeah, this one especially needs more attention, because some people do actually benefit from certain accommodations over other accommodations. So you also, like you said, the glasses, some would benefit from the glasses, and some would benefit for more time because they have more processing issues. So yes, it levels the playing field, but you need to really understand the individual and find the right accommodations for them. I think there is so much out there you can do and help, and it doesn't, some of it is just so fine and little, and you're still helping so much.
And the thing, you don't want to just check off all the accommodation boxes. You want to make sure that the accommodation is appropriate for the individual, because there are accommodations that work for some individuals with ADHD, which will make it harder for a different person with ADHD to complete the same task.
Yes, yes, we found this out. My child was given extra time to do something, and that was extra time to count the ceiling tiles in the room that he was put in.
Exactly. Focusing for hours on one thing means that you don't have ADHD. And this is not true, because ADHD is an interest-based disorder, and it means that individuals are able to hyper-focus on a topic that is of particular interest to them. And it's not always something that they can choose either, but it doesn't mean that they can translate that ability to focus to another thing at their leisure or at their choice.
No, so keep it interesting. Yeah, I feel that you can tell the good educators, they know they have to keep their stuff interesting, otherwise they lose all the kids, even the neurotypical kids. People do, it's just nature. It's the only difference in the neurotypical to the ADHD is they can tell themselves that even though it's boring, you need to refocus here, and they will. They can put some of those brain chemicals into that refocusing. They don't find it as challenging, whereas we're trying to find a way out.
Exactly. ADHD is overdiagnosed, and this is not the case. It's actually underdiagnosed, especially in females. And as we're learning more about ADHD and its various presentations, we are realizing that it is underdiagnosed, and there are individuals that have ADHD that have been masking it and figuring out ways to make it work, or they've been self-medicating and having issues with addiction, where if we're able to identify the ADHD and help them support their weaknesses, and they'd be able to succeed on a bigger level.
I feel this is a very crucial thing, because it's becoming more awareness out there and more education out there about ADHD. Sometimes when you mention ADHD, there's a roll of eyes. Yes, everyone has ADHD. And even the GPs, even the doctors, they're like, oh, it's all overdiagnosed. But if they understand that if they got them early, if they diagnosed them early, they wouldn't be self-medicating. They wouldn't be, there's, 5% of the population is a very conservative estimate for ADHD is, and yet 25% of the prison population is ADHD is, and that's around a lot of the countries. I've gone and looked for the statistics, and generally 25% of the prison population around the world has ADHD. It's not a very good statistic. So something's gone wrong. We haven't identified, and we haven't put in support structures, and we haven't helped those people, because it is a neurological disorder. It is a struggle, and we've left them to their own devices, and they've come up against some struggles and ended up in the wrong place. I feel very strongly about this one. I feel especially the females, again, not displaying the squeaky wheel, hyperactive, impulsive, possibly being more inattentive or compliant, or masking their struggles. So they go left to struggle with everything and not find out until they have a child that it's difficult. So I find these if people understand this particular myth and understand that it is underdiagnosed and support the early intervention, it would cut down on a lot of crime. It would cut down on a lot of addiction, a lot of money in the health system, a lot of mental health days off work, production. Deloitte did a report last year, and they said it cost the Australian economy in 1 year $20 billion. They broke it down into the health and the criminal and the work productivity. That's a lot of money that ADHD is costing the economy. And if we directed some of it into the support structure, you might not have as much addiction of illicit drugs and alcohol, or even family violence, because we have quite a lot of issues here as well with that. And there's some statistics out there that 50% of the court mandated anger management courses end up with ADHD diagnosis.
Yeah. ADHD is not a recognized disability. And the WHO, which is the World Health Organization, and developed nations confirms that it is a disability. Again, that's going back to the fact that it's a neurobiological condition. There are brain differences that can be measured with the chemical imbalances, and it can be shown on these PET scans that the brain works differently.
Yes, and obviously WHO aren't going to identify that unless they've got lots of studies and backups and science and evidence. So I feel that's who everyone does turn to say whether it is or isn't. So if we're not treating it as a recognised disability and trying to help and put in structures and supports and early intervention and just easier ways of dealing with this condition, then we're going to cause some problems in our societies.
Yeah. Okay, next one. ADHD can be treated with herbs and vitamins. No, ADHD needs therapy at the least. So there are medications you can take. You're going to need some behavior interventions, some executive functioning skills, an exercise routine for the ones that have the hyperactivity, to make sure that they're able to get what their body needs to succeed. And you're not going to be able to find a complete treatment by simply taking herbs and vitamins.
No, but the herbs and vitamins help everyone, don't they? I mean, if you're deficient in a vitamin, you're going to need to help yourself with that vitamin. However, that's relating it back to diet. If you have a good diet and you're getting the right vitamins and minerals, it's still not going to cure it. It's not going to make it worse. But you need to understand that it is neurological. It is a physical brain difference.
Final myth: everyone has a little bit of ADHD. And no, they do not. They have the symptoms or the characteristics at times, but it's not the same thing. ADHD is with an individual 24/7. There are a list of diagnostic criteria, and to get a diagnosis of ADHD, you can't just have one or two on the list. Depending on your age, you need between 5 and 7 of these characteristics to meet the diagnostic criteria for ADHD. And when you talk about, oh yeah, that's just my ADHD or something, and you don't have ADHD, it cheapens the diagnosis and it frustrates individuals who do legitimately have ADHD and experience it day in, day out, not having it able to turn off in their life. It's a very frustrating thing to say. And also for the parents, oh yeah, my child's ADD for this or whatever. And it just, I know that some people say it trying to make it so, oh yeah, they can relate to the situation. But I don't know. I have always felt it's not an appropriate way to try and share your feelings or your experience with an individual.
Yeah, I can understand why they say it, but I agree with you in that they're not understanding the struggle, the effort, the negativity that comes with it. They're dismissing that in that person. And some people really have some awful struggles because of ADHD. And the symptoms are experienced by a lot of people over their lifetime, but it's when it's fully impacting the person. And like you said, it's a diagnostic criteria. It's not just a GP that's going to diagnose you. It has to be a specialist, and it has to be a process of elimination. It's not an easy diagnosis to get. And so they need to understand it is serious. It is impacting people greatly. And it would be nicer if people would understand that more, that it can be such a struggle and so negative at times.
Thank you. Thank you so much, Selina. This is an amazing list of myths, and I think everyone is going to benefit from hearing these. I really appreciate you coming on with me today. Thank you.
I appreciate you inviting me. Thank you very much.